If you've noticed changes down there as you get older, you're not alone. Many men over 50 quietly worry, is my penis shrinking? It's a question that's not often talked about, but it's very real and more common than you might think. The good news?
There are ways to protect and even improve your penile health naturally and safely. I'm a urologist, and in this video, I'll guide you through what's normal, what's not, and what you can do starting today. As men grow older, it's normal to notice changes in their body, including the penis. One of the most common concerns among older men is whether the penis gets smaller with age. The honest answer, yes, some shrinkage is possible, but it's often gradual and linked to natural aging processes. Let's break it down simply. Over time, the body undergoes many changes. Muscles lose strength, joints may feel stiffer, and hormone levels decline. The same applies to the penis. Tissue inside the penis, which helps it expand during arousal, becomes less elastic. This means it may not stretch or fill with blood as efficiently as it once did. As a result, the penis may appear slightly shorter or thinner over the years. Another key factor is the reduction in testosterone, a hormone essential for male sexual health. Testosterone naturally declines with age, especially after 40 or 50. Lower levels of this hormone can lead to reduced firmness during erections, and over time, less frequent erections can lead to mild shrinkage. It's a bit like a muscle that's not used often. It tends to lose tone and strength. Weight gain, particularly around the belly area, can also make the penis look smaller. When fat builds up in the pubic region, the area above the penis, it can cause the penis to appear buried or shorter, even if the actual length hasn't changed much. This is especially common in men with sedentary lifestyles or poor eating habits. Another cause is reduced blood circulation. As men age, blood vessels may stiffen or narrow, limiting blood flow. Since erections rely heavily on good circulation, this can affect not only performance but also size of erections. Without regular, healthy blood flow, the erectile tissues can weaken over time. Some men may also develop Peyronie's disease, a condition where scar tissue forms inside the penis, causing curvature and sometimes shortening. Though not everyone experiences this, it becomes more common with age and past penile trauma. It's important to remember that minor changes in penis size are often a normal part of aging. However, they are not always permanent, and in many cases, they can be prevented or improved with the right approach. Staying sexually active, exercising, eating well, managing chronic health conditions like diabetes or high blood pressure, and seeing a urologist regularly can all help. In summary, yes, the penis can shrink slightly with age, but this is usually due to tissue changes, lower hormone levels, and blood flow issues. It's nothing to be ashamed of, and certainly nothing to panic about. With the right information and healthy habits, you can take control of your intimate health and age with confidence. Let's talk about two major forces that affect penis size as you age: blood flow and hormones, especially testosterone. These two factors play a vital role in maintaining not only sexual function, but also the structure and appearance of the penis itself. First, let's look at blood flow. An erection depends on healthy blood circulation. When you're aroused, blood flows into the penis, fills the spongy tissue, and causes it to expand and harden. If blood isn't flowing properly, because of aging arteries, high blood pressure, diabetes, or cholesterol buildup, the penis may not expand fully. Over time, if this happens often, the tissues can weaken, and you may notice a slight reduction in both length and girth during erections. It's like a balloon that isn't filled with enough air. It simply won't look or feel the same. Now let's move on to testosterone, the primary male sex hormone. Testosterone is responsible for many things: your sex drive, muscle strength, mood, energy, and yes, your penis health. As men age, testosterone levels start to gradually decline, often beginning in their 40s or 50s. This drop is called andropause, similar to menopause in women, but more gradual. Lower testosterone levels can lead to fewer spontaneous erections like morning wood, weaker or less frequent sexual arousal, reduced firmness, and size of erections. Without regular erections, the erectile tissue isn't being exercised. Think of it like any other muscle in the body. If it's not used often, it can shrink or lose strength. The penis may appear smaller simply because it's not being used or filled with blood as regularly as before. And here's something else to keep in mind: blood flow and hormones are deeply connected. Testosterone helps keep blood vessels healthy and responsive. When testosterone drops, it can indirectly cause blood vessels to stiffen or narrow, again affecting blood supply to the penis. Fortunately, there's hope. Improving your circulation with regular exercise, healthy eating, managing cholesterol and blood pressure, and avoiding smoking can all protect your penis from age-related changes. Likewise, if your testosterone is low, certain treatments, like lifestyle changes or in some cases, hormone replacement therapy, can help restore balance safely, especially under a doctor's supervision. The key message: blood flow and testosterone are like fuel for the penis. If either runs low, you may notice shrinkage, but with the right care, you can keep things running smoothly well into your senior years. While aging naturally causes some changes in the body, certain everyday habits can make those changes happen faster, especially when it comes to penis health. Many men don't realize that the way they live, what they eat, how they move, how they manage stress, and even how they sleep can directly affect the size and function of their penis over time. One of the most harmful habits is lack of physical activity. A sedentary lifestyle, especially in older age, slows blood circulation throughout the body. This includes the penis, which relies heavily on good blood flow for maintaining tissue health and erectile function. When you're not active, blood vessels stiffen, oxygen delivery weakens, and the tissues in the penis can gradually lose tone, leading to a noticeable loss in firmness and even size during erections. Smoking is another major contributor to penis shrinkage. Smoking damages blood vessels, making them narrow and less flexible. This restricts blood flow to the penis, leading to weaker erections and less frequent arousal. Over time, this can cause a real, measurable decrease in erectile size. In fact, studies have shown that men who smoke regularly are more likely to experience erectile dysfunction and penile atrophy shrinkage. Alcohol overuse also plays a quiet but harmful role. While an occasional drink may not be a problem, regular heavy drinking can damage the liver, lower testosterone levels, and impair nerve sensitivity. These effects combined reduce sexual desire, weaken erections, and shrink the functional length of the penis during arousal. Poor diet is another key factor. Diets high in sugar, unhealthy fats, and processed foods can lead to obesity, diabetes, and high cholesterol, all of which impair blood flow and hormone balance. Carrying excess fat, especially around the belly and pubic area, can also create the illusion of a smaller penis, as the surrounding fat pushes down and hides more of its length. In some cases, it's not just an illusion. These same metabolic conditions lead to real tissue damage over time. Even something as overlooked as chronic stress and poor sleep can speed up penis changes. When the body is under constant stress, it produces more cortisol, a hormone that lowers testosterone and disrupts sexual function. Poor sleep does the same. Nighttime is when your body restores hormone balance and repairs tissue. Without good rest, that healing doesn't happen, and the penis pays the price over time. What's encouraging is that all of these habits can be improved at any age. Just like the body can respond to exercise or better nutrition in your 60s or 70s, the penis can also regain some strength, blood flow, and size when healthier habits are put in place. The sooner these lifestyle choices are addressed, the more you can protect your intimate health and feel confident moving forward. As men age, certain medical conditions become more common, and some of them can quietly impact penis size, shape, or function over time. Often, these changes happen gradually, so they're easy to overlook. But being aware of the underlying health issues that can cause or accelerate shrinkage is an important part of staying in control of your urological health. One of the most common contributors is diabetes, especially type 2 diabetes. This condition damages blood vessels and nerves throughout the body, including those that support the penis. Over time, this leads to poor circulation and reduced sensation in the genital area. As erections become less firm or less frequent, tissue inside the penis may shrink due to lack of blood flow. Some men with long-standing diabetes may also experience erectile dysfunction as a result of these changes. Heart disease and high blood pressure are also major factors. The same arteries that supply blood to the heart also feed the pelvic area. When these vessels become narrowed or clogged due to plaque buildup, a condition known as atherosclerosis, blood flow to the penis is reduced. This not only makes erections more difficult but can also cause the erectile tissue to lose strength, leading to a gradual reduction in pen size. Another important condition is Peyronie's disease. This occurs when scar tissue, also called plaques, forms inside the shaft of the penis, often due to injury or repeated stress over time. Peyronie's can cause the penis to bend or curve during erection, and in many cases, it results in shortening as well. Some men with peyronie's may experience pain during erections, making them less likely to be sexually active, which further contributes to tissue shrinkage. Low testosterone or hypogonadism is another medical issue that can lead to shrinkage. This condition may occur naturally with aging or due to problems with the testes or pituitary gland. When testosterone levels are too low, men may experience reduced libido, decreased spontaneous erections, and loss of muscle mass, all of which can contribute to a noticeable change in penis firmness and size. In some cases, hormone replacement therapy may be recommended, but only under a doctor's guidance. Finally, obesity, especially central obesity, excess fat around the abdomen, has a dual effect. Not only does it lower testosterone levels, but it also physically hides the base of the penis under the fat pad of the pubic region. This makes the penis appear shorter, even though the internal structure hasn't changed. Obesity also raises the risk of many of the other conditions mentioned, including diabetes, heart disease, and hypertension. These medical conditions don't just affect your general health, they directly influence your sexual health too. That's why managing chronic illnesses, taking medications as prescribed, and keeping up with regular checkups is so crucial. The earlier these issues are addressed, the more likely it is that you can protect and even improve the health of your penis, no matter your age. The idea that penis shrinkage is unavoidable with age can feel discouraging, but the truth is, there are several safe, science-backed ways to preserve or even improve penis length and function, especially when addressed early. These strategies focus on protecting blood flow, keeping tissue healthy, and supporting overall hormonal balance. One of the most effective things you can do is stay sexually active. Regular erections, whether from sexual activity or solo stimulation, help keep the penile tissue oxygenated and flexible. Erections work like a form of exercise for the penis. They stretch and stimulate the spongy tissues, which helps maintain their strength and size. If a man goes long periods without erections, the tissue may begin to shrink and lose elasticity over time. Even occasional stimulation can make a big difference in maintaining penile health. Regular physical activity is another key habit. Cardiovascular exercise like walking, swimming, or cycling improves circulation throughout the body, including to the penis. Better blood flow means more oxygen and nutrients to the erectile tissues, which supports stronger and fuller erections. In fact, even light daily movement can help reduce the impact of aging on penis size by keeping arteries and blood vessels flexible. Managing your weight, particularly around the midsection, is also crucial. Excess fat in the lower belly and pubic area can physically bury part of the penis, making it appear shorter than it is. By reducing belly fat, many men notice a visible improvement in penis length without any medications or procedures. Plus, losing weight improves testosterone levels and boosts energy and confidence, all of which are important for a healthy sex life. Pelvic floor exercises, also known as Kegel exercises, are often recommended for women, but they're equally beneficial for men. Strengthening the pelvic muscles helps improve erection quality, control, and stamina. Stronger support from below means better rigidity and blood retention during arousal, which may help preserve the full function and appearance of the penis. Healthy nutrition supports every part of your body, including your intimate health. A diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats like those from nuts and olive oil promotes heart health, hormone production, and proper blood flow. Avoiding excessive sugar, processed foods, and trans fats can reduce inflammation and keep your vascular system working properly. In some cases, men may benefit from medical therapies, such as testosterone replacement, if levels are low, or medications to improve blood flow, like those used for erectile dysfunction. Vacuum erection devices, pumps, when used under medical guidance, can also help improve tissue expansion and temporarily restore size by enhancing circulation. What's important to understand is that most men don't need risky procedures or unproven supplements. Simple lifestyle choices, like staying active, managing weight, eating well, and staying sexually engaged, can offer powerful, long-term benefits. And if there's ever concern or uncertainty, speaking with a trusted urologist is the best first step. It's normal for men to notice small changes in their penis as they age: less firmness, a little less length during erection, or slower arousal. But sometimes these changes are more than just a natural part of getting older. That's when it's important to see a urologist who can evaluate what's going on and help guide you to safe, effective solutions. So, when should you be concerned? If you notice a sudden or significant reduction in penis size, especially over a few months, that's not something to ignore. This could signal an underlying condition, such as Peyronie's disease, reduced testosterone, or a blood flow problem. These issues are more treatable when caught early, and your doctor can help identify the root cause with simple tests or physical exams. You should also speak with a urologist if you're experiencing pain during erections, new curvature of the penis, or the formation of hard lumps or scar-like areas under the skin. These are common symptoms of Peyronie's disease, which becomes more likely after age 50 and can lead to shortening or discomfort if left untreated. Another reason to consult a urologist is if you're having difficulty achieving or maintaining erections, or if morning erections have completely stopped. This could be linked to circulation issues, low testosterone, or even early signs of heart disease. Since the penis relies so heavily on good blood flow, erectile problems can sometimes be a warning sign for bigger health concerns. If you're living with chronic health conditions like diabetes, high blood pressure, or obesity, and notice changes in penis size or function, it's worth getting a full urological checkup. These conditions quietly affect nerves, hormones, and circulation, and early medical guidance can help you protect your sexual health while managing these illnesses. And of course, if you're ever worried, embarrassed, or unsure about a change in your body, don't suffer in silence. Urologists are trained to handle these conversations with professionalism, kindness, and confidentiality. You're not alone, and there's no shame in asking for help. In fact, the sooner you get answers, the more options you'll have for preserving your health and confidence. Many conditions that lead to penis shrinkage or dysfunction are reversible or manageable when caught early. And in some cases, all you may need are small lifestyle changes or medication adjustments. A regular visit to a urologist, especially after age 50, is a smart, preventive step. Just like eye exams or heart checkups, your intimate health deserves attention too. Remember, staying informed and proactive isn't just about treating problems. It's about staying in control of your health and quality of life as you age. Remember, aging doesn't mean you have to accept every change as permanent. You have more control over your sexual health than you realize. If this video helped you feel more informed and less worried, please give it a like and share it with someone who may need it. And don't forget to subscribe, because each week we break down real, honest health advice just for you. Your health deserves attention, and I'm here to help every step of the way.